Okay, hello, everyone. Happy noon hour here on the East Coast, but happy morning, happy day, happy evening, wherever you're zooming in from today for this webinar with these wonderful guests who I'll introduce in a second. My name is Timothy Patrick McCarthy. I'm on the faculty here at Harvard at the Kennedy School in the Graduate School of Education, and I'm the faculty chair of the Global LGBTQI plus Human Rights Program, which is one of the co-hosts of today's webinar, along with the LGBTQ working group from the Advanced Leadership Initiative here at Harvard as well. So very happy as always to be collaborating and co-hosting with that wonderful group. And I also wanted to say that today's title and today's sort of topic and area of focus is called Making Impact Visible: LGBTQI Health, Economic Well-Being, and the Fallout of the Budget Cuts. One of the things that we're committed to in our program at the Carl Ryan Center for Human Rights is to convene leading voices to have tough conversations about the critical moment we're in. And today is going to be one of those wonderful conversations. And so I'm really thrilled to introduce my three amazing friends and colleagues here. I'll start with Brittany Charlton. Brittany is an associate professor at Harvard Medical School, at Harvard Pilgrim Healthcare Initiative, and the Harvard T.H. Chan School of Public Health, and was also the founding director of the LGBTQ Health Center of Excellence, a partnership of the Chan School and Harvard Pilgrim Healthcare Initiative. And then moving in my circle of view here, Meredith Rosenthal, who's the C. Boyden Gray Professor of Health Economics and Policy here at the Harvard T.H. Chan School of Public Health, and is also the Director of Graduate Studies for Harvard's PhD program in health policy. I should also say, Meredith and I have been working together very closely this year on the Senate, the Harvard University Senate planning body. We're on the organizing committee, so we meet, I think, every week, right, Meredith? We've been in lots of conversations, so great to be with you in that capacity as well. And then finally, we have M.V. Lee Badgett, also a friend, longtime friend and colleague here, who's the chief economist and founding partner of COPA, LGBTI plus Economic Power Lab, was a longtime member of the faculty at the University of Massachusetts at Amherst, and Lee directed the School of Public Policy there, right, at UMass Amherst, and was also one of the founding research director at the Williams Institute at UCLA. So we have a distinguished group of folks to take on these big topics, and we'll just launch right in. And Lee, why don't I start with you and ask you to talk a bit about your research? I'd like each of you to introduce yourselves by way of your research and your work in the world, so that people have a sense of the breadth and depth of your work. So Lee, why don't we start with you?
Sure, I'm happy to talk. Thanks for inviting me. I am an economist. I'm a labor economist more specifically, and have spent decades studying inequality, economic inequality for LGBT plus people. And that has, meant looking at wages and for wage differences, differences in poverty rates, and kind of universally, contrary to many people's expectations, we find that there are actually economic inequalities that are negative, that LGBT plus people earn less, and are more likely to be poor, just sort of in general. And and more recently, I've done a lot of work on the economic cost of this sort of inequality. What is its impact on our economies? I know we could talk we will talk about, health issues, but because there are health disparities as a result of inequality, because inequality means you're not efficiently using people's knowledge, skills, and creativity. In every study that we've been doing over the last 10 years or so, we find that roughly 1% of GDP is lost because of that, just looking at LGBT people. Um, so I have also had a career-long commitment to public engagement on these issues, and to make sure that people who need to know these figures know them. They have them in their hands, whether that's activists or policymakers. And so, the Williams Institute work was a piece of that. As you mentioned, really now I am a recovering academic, and now I am in the NGO world, and there are still lots of powerful people who need to know more about what the actual lived experience of LGBTI people plus is in an economic sense. And so that's been my shift into the economic development space, thinking about that. in particular for the role of LGBTI people in developing economies in the global South and East. So that's kind of where I am sitting at the moment.
Great. Thank you very much, Lee. Meredith, I'm going to come to you next. And I neglected to mention that you also were the faculty chair of the ALI program for a number of years as well. I think that's maybe where we first met, but I wanted to make sure I got that since we have an ALI crew in the audience here. Go ahead, Meredith.
Yeah, thanks, Tim. And thanks so much for inviting me to join this wonderful group. And lovely to virtually see my ALI friends. And as you said, Tim, like you, I think, like to cause trouble around the university. And so one way I've done that is through the ALI program, but also through PhD students. And I just want to start by saying that you have incredible experts on the panel. I feel like I've had the privilege of working with amazing young researchers working on LGBTQ plus health policy issues. My own work looks at healthcare financing in the US context. And I have worked with doctoral students, Lindsay Overhage, Wyatt Coma, Alex McDowell, who is now an assistant professor. I've had the wonderful pleasure of working with Brittany, who you'll hear from, and her center and other folks. So I have gotten pulled into taking some of the work that I do that looks at how individuals access healthcare in the US in terms of their financial access to care, as well as other ways that people have to navigate the healthcare system. And then apply that to looking at health inequities for LGBTQ plus populations. And that's really where I have had the opportunity to work in this world. And I know we'll talk more about this. But a lot of the work that we have done, again, with those wonderful young researchers in the lead, has been demonstrating both how health policy and social policy affect people's health outcomes. And in this fraught moment, we will talk a lot about how sort of semi-agnostic health policies, like the ones being debated in the Senate today, have a disproportionate effect on this community. And this work, I just want to underscore, is so important in this moment, just as all of our resources are being taken away.
That's a great setup to pivot
For
to.
Brittany, sorry, Brittany, for that setup.
Brittany, no, it is. It tease Brittany right up. And Brittany, let's go to you now as well.
Yeah, absolutely. So I trained as an epidemiologist. So therefore, much of my work around LGBTQ health uses not only large cohort studies that are longitudinal and therefore looks at various questions like changing sexual orientation or gender identity over time, but also looks at really nuanced subgroups within our community, particularly because I'm interested in a lot of reproductive health topics. A lot of my work has focused on individuals who might identify as heterosexual, but who have same-sex partners or same-sex attractions, who often have some of the worst reproductive health outcomes. So I think a lot about not just kind of these smaller groups within our community, but also just the mechanisms through which they may have adverse health. I've also now been expanding more recently into using sort of more real world data. So not only EHRs, but claims data, certainly some mixed methods work as well. Apropos this moment, and certainly over the last, 5 to 10 years, I've been moving more into the policy space and really looking at the impact of mostly discriminatory, but also some supportive policies as well. So policies like curriculum laws and how they may impact health, particularly around mental health. Sort of counter my research, much of my focus is around sort of more programmatic work within our Center of Excellence. So that includes, continuing to work a lot in the research space, but also having two other pillars. So the first of which is really around training. So training students who are either at the medical school or the School of Public Health, expanding our course options, also training them how to do other skill sets like writing op-eds, for example, to ensure that they're getting their work out into the world. And then we also focus more specifically on dissemination. So really ensuring that any research that does come out is really making it into the hands of policymakers, as we mentioned earlier, but also using new media as well in terms of trying to reach the community more directly. And as Meredith teed me up so nicely, much of this work for the last 10 years has been possible to be funded by the NIH, which was not the case before. And I think we can talk about what that has looked like and how that's going to be really relevant now in the moment. But I really got this center started with the generous support of actually a number of ALI alums, including Mike Dillon. But much of our research requires resources that are much larger, on the scale of, $5-10 million for a single project over a number of years. And the easiest way until about 4 months ago was to use federal dollars for that. And so our team specifically had really moved away from doing a lot of foundation funded work and instead had focused on having NIH funded work, which has been phenomenal in terms of really growing our research and being able to answer unique questions that, require biomedical samples, for example, to measure things like stress as another way to get at discrimination. But I'm sure, as you can all imagine, the last several months have been very difficult. And so it was actually Meredith who gave me the advice in early March of, should I go on the record and speak out about some of the early terminations, and decided to do so. And not too surprisingly, a week later, my entire portfolio was wiped out. So it's been interesting to sort of navigate this space in terms of deciding to bring a suit as an individual plaintiff against the NIH. And of course, we've made some real progress with that suit in the last week, but we have a very long road ahead.
Thank you, Brittany. I appreciate that. You've also teed me up now to pivot to the next line of questioning. But let me first say, too, because my love language is public affirmation. It's one of the things I try to do as much as possible. And since I have the three of you gathered here today for this conversation, I just wanted to say one of the reasons why I wanted to bring all of you together is that you are models, and we're early models and consistent models of people who work at the interface of the highest level, most rigorous kind of research in your field, and people who understood and understand the critical importance of getting that research translated to the public and in the hands of policymakers and other people who can have that impact. The three of you are role models in that regard from my perspective. I just wanted to say that. Let me also say to the audience that we will be having some time for Q&A in the later portion of our conversation. We'll talk for another 25 or 30 minutes, and then we'll open it up at the end. So please put your questions in the Q&A or the chat, and I'll be sure to try to lift them as we go along. Brittany, let's start with you, and then we'll go to Meredith and then Lee. And I wanted to talk about this current political landscape. You've all referenced it. We all know it. We deal with it every day. Speaking of stress, we're all dealing with this in our own ways. And this is a political landscape that isn't just simply about, although it's bad enough, budget cuts, right? We're talking about not just budget cuts, but the defunding, specific and targeted defunding of particular kinds of research, particularly in the field of LGBTQI public health and economics and all across the board. The humanities is also getting gutted in these regards as well. So it's not just budget cuts and defunding of research, it's attacks on universities, on the freedom of speech and expression, rollback of rights, right? A sort of a full frontal assault really on LGBTQ and other kinds of people. And so this is a multifaceted crisis, and it's a political landscape that's quite dire. And I don't think that we should sugarcoat that, not that anybody here would. But if you could talk a little bit, and Brittany, you've already done this with talking about the lawsuit and the wiping out of your particular portfolio. But if you could talk specifically about, because a lot of people don't understand the dynamics of this, like specifically about what that means, right? To wipe out your portfolio. How is the budget cuts and all of this sort of attack impacting how you do your work and the nature of your research, and also the populations that you're concerned with and about and connected to? And I'll ask each of you to respond to that.
Yeah, so beginning at the start of this field, which I think we could debate when that really began, but I'll at least say it's sort of modern approach to this. I think of a lot when I came into the field in the 90s, and there really were just a handful of peer-reviewed studies that were coming out, and much of that work was funded in all sorts of creative ways, generally not by the federal government. And it's just been incredible to watch our field grow. I mean, now there several thousand papers every year that you can find within within PubMed, for example, and most of those are federally funded. It was really in the last decade that we've been able to get really robust funding from federal sources. In 2015, the NIH designated LGBTQ populations as a health disparities population. And that was a really critical moment because it not only, recognized our existence and sort of, the inequities that we may face, but more importantly, in a way, it opened up a lot of new funding mechanisms. And so rather than sort of tucking in LGBTQ related work into other federal studies, we were able to actually have a real focus on this and therefore, have a focus on subpopulations, be able to answer really interesting policy questions, but also really begin to build out areas that were not just around HIV, for example, which was already relatively robust. And so I've been just so heartened to sort of see this field evolve more. And yet, what that has meant is that we've become reliant on the NIH in many ways. Again, the budget for federal dollars is often much larger than a foundation award. You might also think about just the role of being in the academy as well. Many of us are rewarded and move up in the tenure system by getting these big awards. And so I think there's also been a movement to try to get many of us to get many of these very large awards. However, when there's a change, for example, in administration, there can be a swing. Never have we seen a swing like this. I think swing is not the word I might choose. But I also think it, therefore, early on in kind of mid-January, going into February, when we started to see grants be terminated, if you're well aware of the ins and outs of NIH, you knew that this was a constitutional crisis, right? Having existing grants be terminated is wholly different than an administration coming in and sort of setting an agenda, right? And again, we see that coming in. I mean, even under Biden, you might think of examples like the cancer moonshot. There are absolutely ways that administrations will come in and shape subsequent science. But having existing grants that are congressionally mandated, right, in just the terms of the money has been allocated that way, this was a huge, huge upset. And many of the things that we had anticipated in this space by reading Project 2025, like state block grants, and potentially a focus on regret, for example, and we think about gender affirming care, they hadn't exactly designed or mentioned this plan in terms of canceling existing grants. And I think even on top of that, the additional language that has been added in and then taken out and then added back in around the sort of like civil rights language of federal grants, I think is really going to make it difficult potentially for researchers to do any health equity work in the sense that it may endanger organizations to take any money or even do work that then may jeopardize the rest of an organization. So I think there's a lot of pieces to this. Not to mention just what's happening in the larger sort of policy arena, not only LGBTQ specific policies and laws, but also just watching the Supreme Court, right? Like just seeing the undergirdings that came out of Dobbs and how that is then being used, whether it's in Scrimeti or anything else, is just so disheartening.
Yeah, absolutely. Yeah, and the Supreme Court, I mean, the last couple of weeks has just compounded all of the previous pain of the policy decisions, budget cuts, and so forth that you're talking about. Meredith, how about you, and then Lee?
Well, I would just say, kind of building on Brittany's comments about NIH funding, in my role with the PhD program in health policy, and I mentioned earlier, I got involved in this area of research because of PhD students and junior faculty at the School of Public Health, looking for an intersection between LGBTQ health and health policy. And what strikes me is that even if the NIH funding were to get turned back on again in a year, the pipeline it has really been decimated. I have so many students, including those whose work has been published in the top journals and who've been really building the next generation of research in this area who are now thinking, well, I should switch because there's just too much risk. If I want an academic career, I'm going to need to focus on something else. And that is, it's personally heartbreaking because I always, I'm sure, Brittany, the same, say to our students, you have to work on the things that you're passionate about. Research is hard, academic careers are hard, and it really needs to be meaningful to you. And for students who have pursued these areas because of their sense of human rights being at stake, to tell them that they should stop, it just feels incredibly wrong. And but also, it really means that 5 years from now, we have to wonder what the state of the field will be relative to, as Brittany was saying, the last decade has been a time of real flowering, and to consider that really lost is really a tragedy. So we'll talk about the impacts on people outside the academy, but I am really concerned that the field is being held back for the long term by these cuts.
Thank you, Meredith. I appreciate it. That's a sobering reminder, but thank you for voicing that. Lee.
I think we're seeing something very similar in the economics profession. I think in terms of the loss of funding, what it's going to mean in the future. It's horrifying. It's tragic. It's really important to have that research because it has been so useful in showing about the lives that we lead and how we need policies and programs that will that will ameliorate or at least mitigate some of these challenges that people face. I'm not an academic anymore, but I do see that even in the academic space, and certainly in the NGO space, there's a huge chilling impact on speech. Websites are being scrubbed. Social media is being heavily, self-censored, I think, by people. And that's also in academia. I won't say what I said, but I did write a letter to a bunch of people coming to a conference that I'm helping to organize that my wife saw and said, you can't send that. The conference and sort of anyway, all the impacts on our students who want to do this work and come to conferences to talk about their LGBTQ work has just become so much harder. The loss of data is a serious issue. That is our lifeblood. And the economic development space, the USAID, may it rest in peace, moment of silence. The demographic and health surveys were, taken down and, rescued. They're out there, but they won't be updated. For us and the economic development space, I think the collective cost of cuts of just USAID and State Department funding for the global LGBTI movement cut 30% of the budgets of the entire world doing, of civil society doing work on LGBT issues. And, the multilateral development spaces like the World Bank and other places, which actually are very interested in research on health disparities in other countries outside the U.S. They are, they're having to really scale back and tone down and just, kind of quietly try to wait out whatever may be happening in those kinds of spaces. So yeah, so all this has been tragic. And, in terms of the actual work being done on economic empowerment, I mean, basically the loss of USAID meant that all the projects that they were funding for LGBTI people, and they were starting to do much more work on that, was basically ground into dust. The monitoring and evaluation efforts can't even continue to learn what we could have learned from the work that they did. So, it's kind of an endless cycle or stream, to kind of see, how this all fits in together to really create a very devastating environment, both in terms of research and actual policy work.
Yeah, thanks, Lee. It's interesting you had mentioned earlier, you mentioned that crafting an email. I'm actually writing an email right now that's going to go out later on today that I'm agonizing over for some of the reasons I'm sure were in you and your wife's mind when that happened. Vetting emails has become a domestic practice in our house
Mm.
as well. Um, I'd love to drill down a little bit into some of the specifics of your work, right? And Meredith, I want to come to you first on this, but you've done work on the impacts on state bans on healthcare provisions on the mental and physical and other kinds of health experiences of LGBTQ youth. So I'm wondering if you could talk a little bit about that. And you work a lot on healthcare costs and provisions and so forth. And obviously there's a bit right now in the Senate, right? They're debating, cuts to Medicare and Medicaid and these kinds of things. So I mean, this is a large systemic macro crisis right now. But if you could talk a little bit about those state level bans and their impact on LGBTQ folks would be great.
Sure. So I think you're referring to work that the doctoral student I mentioned earlier, who's now finishing up her medical training, Lindsay Overhage. That work really looks at bans on conversion therapy in the healthcare system. And Lindsay finds that there's strong evidence that those bans reduced suicidality among youth substantially by about 10%, statistically significant and obviously incredibly important. I think we can generalize from those results that both the direct and indirect effect of health and social policies on people's well-being is really critical in this area. I think Brittany was pointing to other Supreme Court decisions. The environment of sort of inclusion and its opposite makes an enormous difference on people's mental well-being. And so that's something really important to think about. Part of that also could include uh, laws or regulations that relate to access to gender-affirming care for people both enrolled in Medicaid and also in commercial insurance. And I think, we're going to see a lot of changes there. Obviously, just cuts to Medicaid overall are going to have a huge impact, particularly on gender minority populations who disproportionately enroll in Medicaid. And then even for people who stay on Medicaid, changes in their ability to access gender affirming care will have really important effects too. So I think there are a lot of layers to this, and as those of us in public health are always reminded that we may worry about health insurance and healthcare systems when it comes to people's health, but actually the social environment is at least as important. And unfortunately, these trends are conspiring to really threaten people's health. So now, above all, it's really important to keep this research going forward and keep shining a light on these impacts and making arguments to policymakers about reversing some of these trends.
Yeah, thank you, Meredith. Brittany, I want to ask you a question because a lot of your work has focused on issues of health disparities and the relationship between gender identities and sexual orientations on health outcomes and health disparities. So I'm wondering if you could talk a little bit about how your work up to date, up to this time, helps shed light on dealing with the sort of disparities in this moment. How do we think about that, the insights of the research on the fight back really and how to intervene in this moment.
Yeah, so each subfield within LGBTQ health is really in a different place, right? I mean, I think I mentioned that the HIV space has certainly moved along more quickly than others. And much of my work focuses on sexual minority women, for example, which is a little bit more in its infancy. And certainly, much of my early work in that space was very descriptive. And certainly that's true for a lot of fields, right? So just noting things like the number of teen pregnancies that were happening among LGBTQ youth compared to their cisgender heterosexual peers. And That's one nice example in the sense that the results can sometimes, I think, push people to really think about, what does sexual orientation mean and why might there be disparities, right? So when we talk about inequities, we often think about like a minority stress model, right? Where we encounter all sorts of things in our day-to-day life that are stressors, and we think about those in a very simplistic way, like getting underneath our skin and making us sick. But I think an example like teen pregnancy is actually a little bit more complicated. Certainly, people are encountering minority stress, but we also hear from research participants that they're actively seeking out a teen pregnancy as a way to conceal their sexual orientation or their gender identity. And so I think getting at that complexity is really important for our research. But again, we're really still describing some of these differences. So it was not more than about a year ago, we had a paper come out looking at mortality, showing that LGBTQ people are more likely to die at an earlier age than their peers. And that just required us having enough data that was not only longitudinal, but obviously then over enough time. I think the other thing that I think about is just moving beyond that descriptive space, right? Moving on to even causal models. So picking up where Meredith was just talking about, we have a lot of work that's really focusing on some of these newer laws and policies. So things like religious exemption laws, and really looking at how that may lead to adverse health, particularly among LGBTQ young people. But then also moving again into more intervention spaces, thinking about like medical education interventions or even interventions around the obstetric space. So, for example, a lot of the early work in the reproductive health space was looking more on the GYN side. So, looking at things like inequities around pap tests or even, mammograms. And so much of our work over the last several years has really been moving into the obstetrical space. So, really looking at particularly around pregnancies. And some of that work is just, it's absolutely heartbreaking. One of our postdoctoral fellows, Colleen Reynolds, has a paper that demonstrates that particularly lesbians are about 3 times as likely to have had a stillbirth compared to their straight peers. And again, it would take more research to really get at what's underlying that, but we could certainly come up with hypotheses around people delaying their care, right? Having decreased fetal movement, for example. And if you're in any sort of minoritized group, you may just hesitate, whether it's by hours, days, to be able to go in and be seen. Again, we need much more research in that space. And that paper actually is an unfortunate example that now that our funding has been cut off, that paper may never see the light of day.
Thank you, Brittany. Appreciate that. Lee, so much of your work and certainly your recent work, but over the course of your career has been on economic well-being within minoritized populations, LGBTI populations, of course, and also the cost of inequality on our community and to our society of this. And I'm wondering because one of the things that's so interesting here that's clearly surfacing in this conversation is how vital it is for research to not just lead to new discoveries, but new discoveries that actually may complicate how we understand, right, different people's lived experiences. The idea that, there's the kind of a kind of stereotype of LGBTQ people as more affluent than everyone else, sort of freer to make decisions about travel and these kinds of things, not having the same kind of concerns about family or reproductive freedom or justice or rights that other people may have. So, I mean, this research is all complicating the kind of one-dimensional and sometimes caricatured narratives that exist about our community and our people. And so I'm wondering if you could talk a little bit about this role of economic well-being in terms of the sort of health and human rights of LGBTQ people and what we can do to advance it in a time where it feels like it's being assaulted and on the retreat.
Yeah. This idea that we can talk about economics is a little bit separate from health. I think it is important. I think there's in the United States during the marriage equality movement, for example, we learned that actually people paid attention to numbers that come with dollar signs on them. That is something that took a little bit of the heat out of the emotion out of some of the marriage equality debates. To say, well, it's good for families because the economic inequalities they face will be lessened. It's not hurting anyone else. We have lots of research on that now. It's also something that could be good for local businesses. You know, people spend, in my view, a crazy amount of money on weddings, but it is something that we found can be a boost locally. You know, so people were paying attention to those arguments, and I think taking it to the macro level for me was really more about having come into contact with these multilateral development spaces where there were the people had a sense that we needed to focus more on thinking about economic issues and inequality, but they didn't have a pathway in. But you know, the World Bank, their mission is to end poverty and to have shared prosperity. So like uh, looking at the cost of homophobia and transphobia is a direct pathway in the door. And so taking the disparities that Brittany and Meredith have been talking about and saying, those are bad for people because, you know, poor health is not a good quality of life, but it also means that they can't contribute as much to the economy as they would otherwise. So if we take, higher mortality rates and lower lifespans, if we take just the productivity consequences of looking at the other kinds of health disparities, then we can start to just craft estimates of what that looks like. I know it makes those kinds of things make some people uncomfortable because it sounds like you're putting a value on human life and suffering and you know, to some extent, I think what we're doing instead is calculating the cost of those human rights violations, basically. And yet that shift into the language of economics has really opened the way in lots of different spaces that still remain open in other countries and their bilateral development agencies and in some of the multilateral development agencies and in businesses. The private sector cares very deeply about the health of the economy as a whole, but they also care about the well-being of their employees and their financial well-being. We have a lot of research that shows that companies that are more inclusive have higher stock prices, higher levels of profit, have a more creative workforce. So there are all sorts of ways that this is good at the kind of level of the business as well as at the overall macroeconomy. So I think that's where taking all of this research together. I mean, I just did these studies for Nepal, Bhutan, and Bangladesh, and what you have to have is a body of research to do this well, do this kind of estimation exercise well. And, you know, in a lot of countries, we have to scrape that together. But we're starting to get better at doing that. But anyway, so it's both a way to say, do you really want to hurt everyone with these policies? It's like it's like one of the fundamental things we learned in COVID. It's like we are all in this together. My well-being affects your well-being, and this is also true in the economic sense. So I think, you know, hopefully, you know, these are the kinds of arguments that will, you know, pull us back from you know, a much more polarized and narrow view of thinking about politics in the U.S. in particular these days.
Yeah, yeah, I love that point about, you know, this research does allow us to see that we're interconnected, right? And that our lived experiences, though maybe different and disparate in terms of what we're dealing with in any one particular context or any one particular person or group of people, that we are interconnected in this way. I see one of the people who's on the call is Catherine D'Amato, and one of the who runs the Greater Boston Food Bank. And one of the things that startled me when I first got to know Catherine a number of years ago was sort of the extraordinary statistics around hunger and food insecurity among LGBTQ people in the Commonwealth of Massachusetts. And, you know, I remember having a conversation with her and others about, you know, if we're going to call ourselves a Commonwealth, right, then that means that we have to have wealth in common, that we have to have, you know, well-being in common in that way. And this research helps us to understand how we get to those things, right, within the economy, within within healthcare and medicine, within all sorts of other locations where we see these assaults on budgets and rights and so forth. So taking an interconnected view of this and using the research to get to that, but then also being able to tell our stories about what the impact of all of this is, right, on human beings who are suffering, as you put it, Lee, is really important. So I want to turn my last question to you, and then we'll open it up for Q&A. We already have one really good question in the Q&A, which I'll get to in a second, but please feel free to add to that as well, and we'll get to as many as we can. I wanted to get to resistance. I want to, I'm a historian of social movements, and I believe in people power and solidarity and all the things as a way to get to the places we need to get to. And I'm wondering if this moment, what is absolutely a political and social and economic crisis. There's no sugarcoating that, right? We've talked about this, and we can't emphasize that enough. But this is also an opportunity, I think, for new strategies, right? Not just of resistance, but of community building, coalition building, not just survival, but thriving eventually. Because there will be another side of this. There will be, right? We don't know how long it's going to take, or what it's going to be, or whether the country will still be intact as a result. But history will move on in some fashion. And so I'm wondering, what does this moment in history give us the opportunity to do in terms of new strategies of resistance and otherwise, right? Lawsuits, of course, alternative sources of funding, right? The role of the private sector and philanthropy in that, collaboration with new communities and stakeholders, new forms of solidarity, rethinking the role of the research university in a time like this, which we all spend some time doing. So I'd like each of you to just very briefly touch on what you think might be an opportunity in terms of strategy in this moment of crisis. Let me start with you, Brittany, and then we'll go to Meredith and Lee, and then we'll open it up for Q&A.
Yeah, I think my biggest focus here has been, I guess I would say two-pronged. I mean, one, speaking out to the public via the press, but then also thinking about actual lawsuits. And as you were speaking, Tim, right, thinking about coalition building. I mean, we had just a huge win in this NIH case. So just 2 weeks ago, we had a trial that is essentially weighing in on the very first part of our case, and that was terminated grants. And the judge was a Reagan appointee, and it could not have been a more powerful moment to be in the courtroom. I know many people tuned in via Zoom, but there were just a handful of us there, and it was incredibly moving. I mean, not only to hear him question whether or not, if he were in the same boat as all of us, if he would stand up and do something similar, but also just to have him really close with a reflection on his 40 years on the bench, that he had never seen any such explicit discrimination. And not only that, but that it was being perpetrated by the US government. And having him close with commenting about, have we stooped this low, and have we no shame? And in that moment, just standing up and walking out. Again, we have a long road ahead on this, but it has been really heartening to see some grants now be reinstated. There are about 900 in total that are part of that case that should be reinstated. But as I think about coalition building, it has also been really heartening to sort of work with other scientists and just other people in this space, whether it's with NSF, which is on their own but very similar journey. And I think it's just been helpful to really have people think about what's the role that they can play in this, right? Not everyone is privileged enough that they want to file an individual lawsuit or even speak to the press. So I think many of us have thought about what are some avenues that we can open up for those people. So early on, when I decided to speak out in the press, I also just wanted to be a conduit for people. So opening up opportunities for people to send me anonymous emails, for example, and getting that out to press. I think showing people how to build relationships with both old media and new media can be really powerful. Using our own relationships, right? Many of us who have NIH funding have incredible relationships with program officers and other people on the inside, many of whom wanted to speak and were whistleblowing, but didn't have a way to get a lot of those messages out in a way that was safe for them. So I think just really think about the coalition building that can happen through many movements, but also in new ways, given this new moment that we're in.
Meredith?
Yeah, I guess I would agree that I think the coalition building is really important. One of the things in the last few months that I have found so painful, among others, is the kind of erasing of this important work, and the words, the ideas. I think it's really important that we don't let that happen, and that means allyship. It means bridging across the broader scientific community. This should not just be an issue where the people advocating are people in the affected community. So I think that's really critical, and so all of us need to step up around this issue and other aspects of our work that where there is this attempt to erase them. And so I think the related lawsuits. I'm one of the people involved in the AAUP lawsuit that needs to speak to these issues as well. So I think that's really going to be critical, and obviously new partnerships with industry, with private funders they're not going to be enough to replace federal funds, but they are really critical. And one of the things Brittany alluded to earlier is a big challenge in this area is the lack of data, which is also a kind of erasure. And so I would say, private investments in data collection that will allow us to really document this moment and people who are affected. That's really critical. If the research doesn't get done for 3 years, but the data exist, that will be really important. So I would say that we really need to invest in avoiding the possibility of erasure.
Thank you for that. Lee?
Absolutely. Ditto, ditto, ditto. I guess I would say that, yeah, we have to keep going. We have to keep moving forward. I think those of us who are old enough remember those times that Brittany was referring to where there wasn't funding. And in fact, to be really honest, there are many universities and faculties across the country, around the world, who don't have the kind of resources that you all are talking about and have never had them. And yet they are still able to produce really good research. So I think, we may not be on the path that we want to be on exactly, but we can keep going. We've preserved a lot of data. There's a lot left to learn from that data. Other countries are starting to collect better data on sexual and gender minorities, and those are other sources that we can work with, and many opportunities to partner with people, with academics in those countries, who have similar kinds of research interests. So I think there are lots of opportunities that we might be a little bit more pulled toward. I just want to say, I do think from the movement perspective, that I think a lot of people are now, over the last few years, but I think now especially realize that we need kind of alternative pathways to some of the policy pathways that we've had, to having better livelihoods, better lives, and that many of those might be through economic means that are things that we do again have at our disposal, whether it's training people to be entrepreneurs, especially in informal economies. That's a very big way that many people continue to be able to support themselves. There's a lot of concern about organizations and their durability or sustainability. I like durability because it sounds like we are building something that can withstand this. I've heard this from other people. So a lot of organizations are looking at models of social entrepreneurship. It's not an easy path, but it is something that puts a little bit more control into our hands instead of, as my colleague Fabrice Hudard says, being at the whims of straight people, uh, powerful straight people. And other kinds of things that people have been doing are trying to raise money. The Global Philanthropy Project I think is very close to getting commitments of an additional $150 million in funding over the next couple of years for the global LGBTI movement. Again, doesn't make up for USAID and for the loss of some big funders in that space and some other governments that have also cut funding. But it is saying, let's think about this. Let's think about, building wealth through things like property purchases. Can our movements, own land where they can have their own offices and maybe rent space out, or even create their own housing complexes, or building health clinics, all sorts of ways that we can think about a more durable kind of movement that's about providing the resources that we spend a lot of money trying to lobby about. So I'll stop there, but those are just a few ideas that I'm seeing out in that space.
Yeah, thank you for that. I appreciate it. There's also a really interesting kind of return to a mutual aid model within certain kinds of communities that I see. I live here in Provincetown, and there is definitely a kind of a reimagination of what it means to take care of each other during this time. And there's lots of debates about how to do that. But I was talking to someone the other day who said that we need a massive redistribution of wealth and resources and access within our community, right? And that would help. We can't wait for capitalism to do that or the federal government to do that or whatever, but we could do that with lots of different kinds of decision making. I was also talking to someone who is a very large funder in university spaces recently, who said that we can't wait until we're gone to give our money. We need to give our money now so that the institutions can
die with zero. Yeah,
die with zero, right?
Die with zero.
But I mean, these are that we have to rethink how we personally and collectively are making decisions right now in terms of meeting this crisis for sure. I wanted to turn. There's a couple of questions in the chat. There are two I want to put together because they're actually in tension with one another. So one from Baron, I hope I'm pronouncing that right. It says, I appreciate the point about the cost and inefficiencies of inequality and inequity. I wonder if there's an opportunity to convey the opportunity for the private sector to invest in areas where the government is cutting back. I'd love to hear your thoughts. And then another person says, I object to the idea that private companies care about the well-being of their employees. So few transnational companies even implement GSC, inclusive non-discrimination policies for their staff. In most countries, there's not a local law that protects against termination based on sexual orientation, identity, gender identity, et cetera. In this environment, without motivation to protect workers and a weakening rule of law, what strategies can we actually use to hold corporations accountable? So one is like, is there an opportunity for corporations and private companies to sort of make up for some of the losses? And another one is like, how do we hold those corporations accountable when they haven't really had a very strong record on and with respect to our community as it stands? So let's weigh into that tension. Lee, you can start.
Yeah. Okay. Yes, the private sector, we at COPPA are hoping will become partners in moving funding into the space where we're working on economic empowerment efforts. And I think, if you think about the traditional kinds of things that the financial sector does, they lend money to businesses to be founded or to grow. Those are things that LGBTI-owned businesses are likely to want to do. Maybe even the social enterprises that may be born in this moment of opportunity / whatever devastation. And so I think it is possible. It's not that easy to do. It is a huge amount of money. It wouldn't take a huge percentage of it, but getting there is tough. And I think, it means working a whole different room. I mean, every time LGBTI people go into new spaces, we have to start over again and explain who we are, why we're here, why we've always been here and you just didn't see us, and what it is, what the reasons are for us, for you to work with us. So I think we're starting to see people spend more time thinking about that and trying to do that. Yeah, the private companies caring about the well-being of their employees. I mean, that's a tough question. I think there's evidence that some of them do not. But I think it also depends a lot on where you are and what the kind of policy protections you might have, what the kind of protections for organizing of workers and collective action might be. I think in the U.S., as I said, we've seen a lot of corporations become much more conscious and much more willing to try to create workplaces that do respond to our needs. And I think, capitalism will not necessarily give you that on its own. If the whole world would be better off with LGBTI inclusion, why aren't we seeing it? Why aren't we seeing capitalists take advantage of that opportunity? And that's because that's not the only thing that, not the only reason why people act. So we have to make sometimes that human rights case is still extremely important, and we have to think about smart, strategic, collective action to make that happen. So I don't think there's a one size fits all kind of way to think about that, and to be totally honest, that in the world of DEI backlash, it is very hard to think about how to what new strategies we can evolve to actually hold corporations accountable. But we can tell them that we're watching. We can tell their employees that they need to speak up, and we can say, we are going to, make our buying decisions based on, what we're seeing and our future decisions about employment, and those kinds of things employers do here, at some level, I think.
Economic boycotts are still very, very powerful engines of social change. Meredith and then Brittany, your thoughts.
Well, I'm going to let Brittany speak to the private sector funding question because I know that she has so much experience with that. But I think in this moment, we really do need to rally just a broader coalition. I don't know exactly what the best strategies are. I was just reflecting on the other question that's in the chat about data and the sense that people who act in support of LGBTQ rights, whether it's research or advocacy, may come under attack. It's certainly a real issue, but it cannot mean that that we just stand back and let this wave wash over this entire community. So I really defer to Brittany, who I know has been working hard to sustain the remarkable group of folks that she has brought together around this. So I'd love to hear what her sense is of the partnership in the corporate world.
Go ahead, Brittany.
Yeah, I mean, I think in this moment there really are opportunities. And I think there's both opportunities to have individual philanthropists step up, as well as just educating, various spaces within the business world. I think about just the large amounts of technical assistance that are now available in the space that were not there 10 years ago. I mean, even something like out leadership, for example, that's coming into various corporate spaces and sort of, bringing in trainings. Within the healthcare space, I think a lot about much of the education that's coming out of the Fenway Institute, for example, that's coming into not only federally qualified community health centers, but also just much more broadly around training providers how to offer more culturally humble care. So I think that there's a lot of opportunities there, not only to sustain our funding, or at least think of it maybe more as a bridge to what's going to be next, but also looking to other ways that we can bring in these resources into the corporate spaces. Not that there's a silver lining to many of our younger colleagues not finding spaces in academia when that might be what they're looking for. I do think it's an opportunity for them to really engage with how they're going to make an impact. I mean, I have trainees who are thinking about working for hedge funds or going into management consulting. And I think they really still have an eye on not only shaping some of that work, but also then devoting their resources to ensuring that this work moves forward. And I think I also just feel excited about being able to partner with other organizations that maybe newly want to move into this space because they recognize that some of our, largest and longest existing funders are now gone. And Catherine D'Amato's note about, this increase in the statewide survey around food insecurity is just so striking. And I think there's so much that we could do to address that. But that's going to require some research as well. I mean, right, we need to understand and study like what is effective. I mean, this is program evaluation, it's implementation science. But all those things can really move the needle, and that's going to require partnerships across the nonprofit, academic, and potentially also even the private sector.
Catherine put a data point in the Q&A where it says that the number the LGBTQ plus food insecurity increased to 56% in Massachusetts to 2024 from 53% just the year before and that's part of an annual study that the Greater Boston Food Bank did with Mass General Hospital. I wanted to just very quickly, 30 seconds each. There's one more question I'd love your thoughts on, quick thoughts on. It's a question about how we get around, right, the political pressure, and you talked about the erasure early, Meredith, around, but the political pressure to stop counting, to stop developing data analysis. Is there a way for researchers, whether they're in universities or in other places, to get around or to resist the sort of onslaught or erasure that we're seeing with respect to data and analysis, which is so crucial to policy and everything else? Well, I'll go Brittany, Meredith, Lee, and then we'll close out.
I think this is complicated, right? I mean, we have spent so much of our careers really making the case that, have people self-reporting their sexual orientation or gender identity is no different than any other, sociodemographic information. And we know that from a research perspective, right? I mean, until recently, we know individuals not only want to report it, but they can report it faster with more accuracy, than other information like income. I do think we are in a different moment, right, of having to think through sort of safety, confidentiality, um, and also thinking about how this moment may impact even existing resources or data sets. So, as just one example of this, I had been working for the last almost 10 years with several colleagues to get the PRAMS, which is a pregnancy risk assessment survey that the CDC runs, to get them to collect SOGI data. And that had just begun. And not only is that data, well, we probably never see it, but also even if it came back online, who knows who would feel safe reporting that? So I think there's a lot of questions, both how we can be responsible to our research participants, but also how we can even just methodologically address data, before and after. And yet, this is not the first time that we've done this, right? I mean, you can think about COVID or any number of big moments in time where we have figured out ways around this. But it is a really complex question.
Thank you, Meredith, and then Lee.
Yeah, you remind me, Brittany, when talking about COVID, that a lot of really creative, collaborative efforts during COVID made a huge difference, where people, started collecting their own data, and we obviously cannot rely on the CDC and others to continue the work that exists, or to expand that work. So I do think those of us in the research world, we need to support particularly the pipeline of researchers in this area, think creatively, and work in new models of data collection. I think Brittany's initial comment about safety around reporting is well taken, and I can understand that people might be reluctant to provide information, but I think there are creative ways of getting around those concerns. And again, I really think the data collection side of this is so critical, that the work can be disseminated in a variety of channels. I think the journals are still publishing this work, and we have to make sure that this continues to move forward.
Thank you. And then Lee, final word from you.
Yeah, I don't have a whole lot to add, except maybe to just say I think the worst thing that we could do is to do nothing. Either to stop the research completely or to not rethink what we're doing, why we're doing it, and to reestablish the connections to the communities that we are, that we are many of us parts of and are doing this work for, in a sense, or with. And I think to get people to start thinking of us as doing it with them, I think would go a long way towards making it a little bit less risky for us to kind of keep continuing as long as things are, in the state that they're in. But we have to keep going. What other option do we have? Silence equals death. We know that from the HIV buttons and work that was done. And we are not. I think people's expectations have been raised. I remember in in Massachusetts in the mid 2000s, where I was getting angry calls from people who said, you know, I'm married. I am legally married in Massachusetts. And when the federal government gets my data, they change it. They make me not married. And that is wrong. I think our expectations have been raised. Let's keep them high and let's, keep moving forward.
Ah, Lee, there it is. There, Harvey Milk says, "Give them hope," right? So there, it's hard to find hope in this time. But I will say, as I transition to our closing here, what a relief it is, and how grateful I am to know that there are people in the world doing the work that you three are doing. As I said earlier, you're role models, you're leaders, and I am very, very proud to call, on this last day of Pride Month, very proud to call all three of you friends as well as colleagues. So. Lee and Meredith and Brittany, thank you for squeezing in one last Pride Month thing that you all agreed to do very quickly and on short notice. And this was a really wide-ranging and vital conversation. And I just want to thank you all for being part of it. And to the LGBTQ Working Group of the Advanced Leadership Initiative, thank you for co-hosting with the Global LGBTQI Plus Human Rights Program at the Carl Ryan Center at the Kennedy School. And for all of those of you in the audience, thank you for your questions. Thank you for your engagement. Thank you for zooming in. And hope everybody has a happy last day of Pride Month and then onward. Let us continue to elevate our expectations and keep the work going.
Happy Pride, everybody.